selamat pagi dan selamat datang kami ucapkan kepada Bapak Ibu hadirin yang berbahagia. Good morning, distinguished guests, ladies and gentlemen. It is our pleasure to welcome you to groundbreaking the strengthening of National Referral Hospitals and Vertical Technical Units Islamic Development Bank Project IDN 1031. Seluruh tamu undangan yang berbahagia, kami persilahkan untuk dapat menempati tempat duduk yang telah tersedia karena sesaat lagi acara akan segera dimulai. Distinguished guests, ladies and gentlemen, please allow us to invite you to please have a seat because our event is about to begin. Thank you. yang berbahagia, kami ucapkan selamat pagi dan selamat datang kepada yang terhormat Bapak Budi Gunadi Sadikin, Menteri Kesehatan Republik Indonesia. Yang terhormat Ibu Sri Mulyani Indrawati, Menteri Keuangan Republik Indonesia. His Excellency Dr. Muhammad Sulaiman Al-Jaser, Presiden Islamic Development Bank. Dan yang kami hormati Profesor Cooka Sukawati, Wakil Gubernur Bali. Ladies and gentlemen, you may be seated. Hadirin dipersilakan duduk. Excellencies, ladies and gentlemen, please allow us to invite you to please be upstanding. Hadirin dimohon berdiri. The National Anthem of the Republic of Indonesia, Indonesia Raya. Hadirin dipersilakan duduk kembali. Hadirin yang kami hormati, sebelum kita memulai rangkaian acara pada kesempatan pagi hari ini, marilah terlebih dahulu kita menundukkan kepala sejenak, seraya mengucap syukur kepada Tuhan Yang Maha Esa. Atas berkatnya lah kita dapat berkumpul pada kesempatan kali ini dalam keadaan sehat walafiat. Excellencies, distinguished guests, ladies and gentlemen, let us take a moment of silence to pray to our Almighty God. Because of His blessing, we can gather here with a healthy condition. Let the prayer begin. Berdoa dimulai. Amin. Berdoa selesai. Hadirin sekalian, mari kita awali rangkaian kegiatan yang sangat luar biasa pada kesempatan pagi hari ini dengan sebuah persembahan spesial. Excellencies, ladies and gentlemen, we will start today's agenda with this special performance.
Boleh saya buka implan saya dulu?
Boleh, silakan.
Coba tutup telinga kalian 5 detik saja. Saya hitung ya. 1, 2, 3, 4, 5. Apa yang kalian rasakan?
Kami tidak bisa mendengar.
Itulah yang saya rasakan sejak lahir.
Pada tahun 2020, diketahui profil dari 84,4 juta anak Indonesia, ada sekitar 0,79% atau 650.000 anak penyandang disabilitas.
Kamu sekolahnya sekolah biasa?
Ya, sekolah biasa, sekolah negeri.
Bagaimana hubunganmu dengan kawan-kawan? Bisa diceritain?
Sama teman-teman?
Ya, waktu kecil. Nggak bisa ngomong juga.
Waktu kecil, seingat saya bisa kok. Cuman tidak tahu arti kata itu.
Timbulnya disabilitas pada anak ini dapat disebabkan oleh cacat sejak lahir, cedera, dan penyakit akut maupun kronis. Sementara, kematian bayi berusia di bawah 5 tahun atau balita di Indonesia mencapai 28.158 jiwa.
Jangan tua besarnya, kunem, mengam, suara satu setengah loma, dan posesif. Jangan TV, apa yang papa tahu? Jangan tua pelai, dan suara pelai balik.
Juga perlu diingat, kesehatan ibu hamil adalah faktor yang sangat penting dalam mengurangi kematian ibu dan bayi. Persentase kematian ibu di Indonesia saat ini kurang lebih 305 kematian per 100.000 kelahiran hidup.
Saya Astuti, umur 15 tahun. Saya suka bertari. Selesai terapi saya juara selesai terapi nasional.
Kita harus bertekad mengurangi jumlah penyandang disabilitas anak di masa akan datang. Kita harus bertekad mengurangi penyebab disabilitas anak yang disebabkan oleh cacat sejak lahir, cedera dan penyakit akut maupun kronis.
Saya Nadir, umur 14 tahun. Saya suka berlari dan cepat.
Kita harus bertekad menurunkan kematian bayi berusia di bawah 5 tahun atau balita di Indonesia. Kita harus bertekad menjaga kesehatan ibu hamil yang merupakan faktor penting dalam mengurangi kematian ibu dan bayi. Kita harus bertekad menurunkan angka kematian yang disebabkan karena keterlambatan penanganan.
Apa cita-citamu?
Saya ingin jadi dokter karena saya ingin menyembuhkan orang-orang yang telinganya bermasalah seperti saya.
Jika tren ini terus terjadi, maka kita akan banyak kehilangan generasi penerus. Upaya mengurangi angka kematian ibu dan bayi terus dilakukan dengan harapan masa depan yang lebih maju untuk bangsa Indonesia. Kita harus bertransformasi kesehatan. Recover together, recover stronger.
Ladies and gentlemen, please welcome the performance from SLB Negeri 1 Badung. and gentlemen, let's give round of big applause by waving our hands like this for the amazing performance of the student of SLB Negeri 1 Badung. And now, Excellencies, ladies and gentlemen, please receive this flower garland from the student of SLB Negeri 1 Badung as a way to welcome our honorable guest today. They are such an amazing, talented student with a special hearing condition. And this is such an honor and it's such a beautiful moment for them to welcome all of you, distinguished guests, ladies and gentlemen. Once again, let's waving our hands, ladies and gentlemen. Good morning, ladies and gentlemen. Selamat pagi, Bapak Ibu, tamu terhormat. Mohon izin Bapak Ibu untuk memulai acara hari ini, saya akan membuka dengan sebuah pantun. Diperkenankan, boleh? Buah mangga, jeruk mandarin. Pergi ke pasar untuk membeli. Selamat pagi para hadirin, rahajeng rauh ring Pulau Bali. Which means welcome to Bali Island, ladies and gentlemen. And since we are here in Bali, please allow me to greet with Balinese traditional greetings, Om Swastiastu. Which means we hope that your life will full of happiness and blessing from God. Assalamualaikum warahmatullahi wabarakatuh. Shalom, namo buddhaya, salam kebajikan, blessed be upon us. Please allow me to introduce myself, ladies and gentlemen. My name is Tis Maniar, and this is such an honor for me to be here as your master of ceremony for today's prestigious event. Ladies and gentlemen, today we are here on Thursday, 17 November 2022, for this very beautiful event, groundbreaking, the strengthening of National Referral Hospitals and Vertical Technical Units Islamic Development Bank Project IDN 1031. Can we have round of big applause, ladies and gentlemen? Thank you, terima kasih. Ladies and gentlemen, allow me to extend our gratitude and warm welcome kepada yang terhormat Bapak Budi Gunadi Sadikin, Menteri Kesehatan Republik Indonesia. Yang terhormat Ibu Sri Mulyani Indrawati, Menteri Keuangan Republik Indonesia. Selamat pagi, Ibu. His Excellency Dr. Muhammad Sulaiman Al-Jaser, Presiden Islamic Development Bank. Yang kami hormati Profesor Cooke Sukawati, Wakil Gubernur Bali. Honorable delegates, distinguished guests, ladies and gentlemen. Hadirin yang berbahagia, proyek The Strengthening of National Referral Hospital and Vertical Units ini merupakan bantuan investasi melalui pinjaman luar negeri dengan tujuan untuk meningkatkan ketersediaan, aksesibilitas, kualitas, dan penyelenggaraan pelayanan kesehatan melalui peningkatan 6 rumah sakit rujukan nasional dan unit teknis vertikal yang tersebar di 5 provinsi. Bantuan sebesar 4.220 miliar 337.600.000 rupiah atau senilai 293,79 juta dolar AS sejalan dengan misi ISDB untuk mengurangi kemiskinan, pembangunan manusia, ilmu pengetahuan dan teknologi, ekonomi Islam, perbankan dan keuangan, dan meningkatkan kerjasama antara negara-negara anggota melalui mitra pembangunan ISDB. Saat ini Kementerian Kesehatan sedang melakukan transformasi kesehatan yang terdiri dari transformasi layanan primer, transformasi layanan rujukan, transformasi sistem ketahanan kesehatan, transformasi pembiayaan kesehatan, transformasi SDM kesehatan, dan transformasi teknologi kesehatan. Melalui proyek ini, sesuai dengan diselenggarakannya transformasi layanan primer dan layanan rujukan tersebut, diharapkan RSUPT vertikal yang menerima bantuan atau pinjaman dapat berkontribusi pada peningkatan status kesehatan ibu dan anak, penurunan kematian akibat penyakit tidak menular atau PTM akibat kanker, dan peningkatan kesehatan respirasi termasuk tuberkulosis, serta peningkatan kesiapsiagaan kegawat daruratan atau bencana. Excellencies, ladies and gentlemen, the strengthening of national referral hospitals and vertical technical units project is an investment assistance through foreign loans with the aim of increasing the availability, accessibility, quality, and delivery of health services by increasing 6 national referral hospitals and vertical technical units spread across 5 provinces, namely DKI Jakarta Province, Darmais National Cancer Hospital Jakarta, and Persahabatan Hospital Jakarta. West Java Province, RSUP Dr. Hasan Sadikin Bandung. DI Yogyakarta Province, RSUP Dr. Sarjito Yogyakarta. Bali Province, Profesor IGNG Ngurah General Hospital Denpasar. South Sulawesi Province, RSUP Dr. Wahidin Sudirohusodo Makassar. Assistant of 4,220,337,600,000 rupiah or $293.79 million is in line with ISDB missions to reduce poverty, human development, science and technology, Islamic economics, banking and finance, and enhance cooperation between member countries through ISDB development partners. Currently, the Ministry of Health is carrying out a health transformation consisting of primary service transformation, referral service transformation, health resilience system transformation, health financing transformation, health human resources or HR transformation, and health technology transformation. Through this project, ladies and gentlemen, in accordance with the transformation of primary services and referral services, it is hoped that the vertical integrated services hospital that receive assistance or loans can contribute to improving the health status of mother and children, reducing deaths from non-communicable diseases due to cancer, and improving respiratory health, including tuberculosis, as well as increasing emergency or disaster preparedness. Hadirin yang berbahagia, pada kesempatan kali ini marilah kita awali rangkaian kegiatan dengan menyaksikan bersama sambutan Wakil Gubernur Bali. Kepada yang kami hormati, Profesor Cooka Sukawati, dipersilakan.
Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Shalom, namo buddhaya, rahayu, rahayu dan rahayu. Yang terhormat Bapak Budi Gunadi Sadikin, Menteri Kesehatan Republik Indonesia. Yang terhormat Ibu Sri Mulyani Indrawati, Menteri Keuangan Republik Indonesia. His Excellencies Dr. Muhammad Sulaiman, President of Islamic Development Bank. Para Direktur Rumah Sakit Vertikal yang juga saya hormati dan saya banggakan, para undangan, Honorable Delegates, distinguished guests, ladies and gentlemen. First of all, let us pray to God the Almighty. Because of His blessing, His grace, we can be here together in good health. On behalf of Bali Government's Province, allow me to welcome you in Bali Island, the island of God and the island of peace. We hope you have memorable time during your in Bali. Bapak Ibu hadirin yang saya hormati, tidak henti-hentinya kita panjatkan puja dan puji syukur kehadapan Tuhan Yang Maha Esa, bahwa hanya atas asung wanugerahanya kita bisa berkumpul dalam keadaan sehat walafiat untuk bersama-sama mengikuti kegiatan groundbreaking gedung pelayanan ibu dan anak dalam program Strengthening of National Referral Hospital dan Vertical Technical Unit. Kita menyadari bahwa derajat kesehatan masyarakat diukur dengan menggunakan indikator angka harapan hidup, angka kematian ibu, angka kematian bayi, dan status gizi masyarakat. Untuk mewujudkan derajat kesehatan yang optimal, maka perlu dilakukan berbagai upaya dalam pelayanan kesehatan, khususnya pada pelayanan kesehatan ibu dan anak dengan peningkatan kapasitas SDM kesehatan maupun pembangunan fasilitas kesehatan. Seperti yang telah dilakukan oleh Kementerian Kesehatan pada hari ini, tentunya dengan dukungan dari Chairman of Islamic Development Bank Group, sehingga dapat dibangun gedung pelayanan ibu dan anak di 6 rumah sakit vertikal yang dimiliki Kementerian Kesehatan, yang salah satunya berlokasi di Bali, yaitu Rumah Sakit Umum Pusat Profesor I Gusti Ngurah Gede Ngurah. Distinguished guests, ladies and gentlemen, before I close my remarks in this very special occasion, allow me to extend my heartfelt thanks to Bapak Menteri Kesehatan Republik Indonesia, and also to Ibu Sri Mulyani, Menteri Keuangan Republik Indonesia, and especially to Dr. Muhammad Sulaiman, President of Islamic Development Bank, for your support that this hospital can be built. Thank you very much, and Om Santi 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 Om.
Terima kasih kami ucapkan kepada Bapak untuk sambutannya pada kesempatan hari ini. Kami persilakan untuk menempati tempat duduknya kembali. Excellencies, ladies and gentlemen, now let us welcome on stage to deliver the speech the President of ISDB, His Excellencies Dr. Muhammad Sulaiman Al-Jazar. Your Excellency, the stage is yours.
بسم الله الرحمن الرحيم والصلاة والسلام على أفضل الأنبياء والمرسلين سيدنا ونبينا محمد وعلى آله وصحبه أجمعين ومن تبعهم بإحسان إلى يوم الدين. Your Excellency Ibu Sri Mulyani, dear distinguished ministers, Your Excellency Pak Budi Sodekan, and Your Excellency the Vice Governor of Bali, our Indonesian fellow sisters and brothers. Assalamu alaikum wa rahmatullahi wa barakatuh. I am indeed very happy and honored to be back in Indonesia for the third time in less than 8 months. This shows the unique importance of Indonesia to the Islamic Development Bank. So what makes Indonesia crucial for us? Indonesia is the 16th biggest economy in the world and the 7th according to PPP. It has been achieving continuous robust growth since the Asian crisis. Indonesia is not only a founding member of the bank, but is also the second largest beneficiary of the Islamic Development Bank financing. And this is just the beginning of a long and challenging development journey. In this regard, I would like to reaffirm the full support of the ISDB Group to Indonesia's strong vision to become the world's 5th largest economy by 2045, while avoiding the middle income trap. With the COVID-19 pandemic that we have all gone through, the middle income trap has become a more open threat for any developing economy. That's why we need now more than ever, to recover together, recover stronger. Ladies and gentlemen, this groundbreaking marks a milestone achievement for recovering together, recovering stronger. We have all seen how the pandemic has halted our reversed years of development progress. The world has spent too much effort and resources to achieve the SDGs since 2015, which were undermined by the pandemic. Achieving the SDGs is a major challenge for every country. In Indonesia, the estimated annual gap in SDGB financing is projected to increase from $10 to $21 billion in 2020 to $175 billion to $355 billion in 2030. COVID has also caused severe disruptions in health service delivery. It has taught us one important lesson, though. Countries need resilient health systems, not only for the well-being of their people, but also to enable sustainable socio-economic development. Every year, 100 million people fall into poverty under the burden of health expenditures. 50% of the world's population does not have access to a package of essential health services. The development literature is full of clear evidence that investment in health yields the highest returns. Challenges make the health sector one of the top priorities in Indonesia's development plans, as well as the Islamic Development Bank strategies. As a development bank, the ISDB places the development needs and challenges of its member countries at the core of its agenda. As a result of this responsive approach, we developed 2 big health projects in Indonesia in less than 24 months. To do so, we carried out a country diagnosis together with our partner, the Ministry of Health. We identified the main health challenges, which are infant and maternal care and oncology. We are here today for the groundbreaking of the first project, which was approved in September 2020, strengthening 6 national referral hospitals of Indonesia. This $262 million project focuses on improving infant and maternal care. The second one, the 205 million euro oncology project, was approved 2 months ago. It will support oncology services in 6 national referral hospitals, and inshallah, I look forward to an expedited implementation of this project too. The project of strengthening 6 national referral hospitals of Indonesia consists of the following: building 10 new health facilities with a total surface area of 230,000 square meters, providing 952 hospital beds and more than 100 intensive care units, equipping 6 hospitals with state-of-the-art medical equipment, training at least 5,500 hospital staff, including physicians, health workers, managers, etc. And finally, supporting the health emergency response capacity of Indonesia. This 6 hospital project targets a population of 77 million people. That means more than a quarter of the Indonesian population. Once the hospitals are in operation, we expect to achieve the following: 25% increase in mother and child inpatient and outpatient services, 22% decrease in maternal mortality rate, 14% decrease in neonatal mortality rate, 10% decrease in under 5 mortality rate. These figures mean a lot to all of us. And as the Quran told us, وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا صَدَقَ اللَّهُ الْعَظِيمُ. In translation in English, the verse from the Quran says, and whoever saves a life, it is as if he saved all of mankind. صدق الله العظيم. Excellencies, ladies and gentlemen, on this special occasion, I would like to extend special thanks and appreciation to Pak Budi, our respected health minister. Without his wholehearted support and strong leadership, we would not have been here today for this historic moment. Pak Budi showed exemplary performance and support. He formed dedicated project teams in the Ministry of Health and the project hospitals. He provided his constructive skills to solve pending matters whenever needed. As a result, the Islamic Development Bank is the biggest partner of the Ministry of Health. Before I conclude, I would like to inform you that I was briefed by the Islamic Development Bank team in Jakarta about the ambitious transformational plans of the Ministry of Health in the areas of improving primary health care service delivery by focusing on community health workers and public health laboratories at primary and secondary levels, and also on improving access to cardiology, neurology, and oncology services across the regions. In this regard, let me assure you that you have the full support of the Islamic Development Bank in this ambitious endeavor. Thank you very much for your attention. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Your Excellency. Please, you may be seated. Hadirin yang kami hormati, selanjutnya mari kita simak bersama sambutan Menteri Keuangan Republik Indonesia. Excellencies, ladies and gentlemen, now let us welcome on stage to deliver the speech Minister of Finance of Republic of Indonesia, Her Excellency Ibu Sri Mulyani Indrawati.
Thank you very much. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu, Namo Buddhaya, salam kebajikan, rahayu, rahayu, rahayu. His Excellency Dr. Muhammad Sulaiman Al-Jaser, President of the Islamic Development Bank, yang terhormat Bapak Budi Sadikin beserta Ibu. Bapak Budi adalah Menteri Kesehatan Republik of Indonesia, yang terhormat Bapak Cokorda, Bapak Wakil Gubernur Bali, yang terhormat seluruh hadirin yang hadir pada hari ini, para direksi, pimpinan DPRD, dan juga para hadirin. Pertama, saya ingin menyampaikan terima kasih atas undangannya pada hari ini untuk groundbreaking hospital building di dalam rangka menjalankan salah satu perjanjian dengan Islamic Development Bank di bidang kesehatan, that is to improve mother and child services in 6 vertical hospitals in Indonesia. And for today we starting with rumah sakit di Bali yang merupakan one of the biggest hospital in Indonesia. I would like to express on this occasion my appreciation to Islamic Development Bank, Dr. Al-Jaser, which support the construction of this hospital through strengthening the National Referral Hospital and Vertical Technical Unit project. As mentioned earlier by Dr. Al-Jaser, that Pak Budi is launching the reform on a health sector, and that's including on the supply side, that is building from the primary health care, strengthening primary health care up to the referral hospital. For this particular project by Islamic Development Bank, they are aiming for improving 6 vertical integrated service hospital. There is Darmais, that's already mentioned earlier. There is Cancer Hospital and Persahabatan Hospital in Jakarta. Rumah Sakit Hasan Sadikin, that is Hasan Sadikin Hospital in West Java, Bandung. And then Rumah Sakit Sarjito in Yogyakarta. And here in Bali, Rumah Sakit Profesor Ngurah in Bali. And then the last one, hospital in Wahidin Sudirohusodo in Makassar. This is one of the very important, what we call it, bottleneck in the health services in Indonesia. So with the support of 4.2 trillion rupiah or 293 million US dollar from Islamic Development Bank, complementing what is the government committed to strengthen the health services in Indonesia. Ibu Bapak sekalian, ladies and gentlemen, we all know that health and economy is the two very strong correlation in terms of improving the livelihood of the people, the welfare of the people, and the health of the people. The ability of the Indonesia to manage and to control pandemic is not separated from all this effort. Government commitment from the budget point of view has allocated extremely increased budget, especially during this pandemic, for health. We are all following from what you call it, national economic recovery and the handling of the pandemic COVID-19 as the very top priority in the past 3 years, 2020 until 2022, in which, in this case, we increase the health sector budget beyond the 5% mandatory according to the law to up to 9.4%. The allocation of government budget in 2022 for the health is reaching 255.3 trillion. So it's a very big sum of money, more than 20 billion US dollar. So the Islamic Development Bank with 4 trillion is actually creating more catalytic approach on not only in terms of the money, but most importantly in quality delivery control, as well as the improvement on how we are going to build these health services, especially in a referral hospital like here in Bali. Minister of Finance will support Minister of Health, Pak Budi reform. We are a strong supporter. In fact, the G20, one of the most important topic on the G20 in the finance track is actually related to the pandemic related and pandemic preparedness, which we were able to achieve a very successful outcome from this G20 Leaders Summit just finished yesterday by establishing pandemic fund or financial intermediary facility. This is because of Pak Budi has been working extremely hard and effective in reaching out for all the G20 counterparts as well as the international organization. In the finance, we are also doing the same thing. We know that health is a very important issue and financing cannot be separated. Without financing, you cannot reach a good health system in any country, and without financing, you cannot prepare and build the pandemic preparedness and response effectively in a global level, regional level, and country level. So this is really a very strong collaboration between Minister of Finance and Minister of Health, but Minister of Finance will not and cannot do anything if the Minister of Health in charge is not the one who championing for this. So thank you so much, Pak Budi, for your leadership. And for this particular facility that is going to be built in Bali as well as the other locations, 6 referral hospital, as Dr. Al-Jazer mentioned earlier, is actually covering almost 70% of the population in the world. The most important referral hospital in Indonesia. Building a hospital and all facility is really important for us, as we also committed during the pandemic and continue post-pandemic. We also see that this is not the only important thing in the health services. Pak Budi has already mentioned you need a health worker, medical doctors, laboratorium, as well as many facility. The system that need to be continued, strengthened, and built. So we are with you, Pak Budi, to support all the reform. And I do hope with this hospital, it is going to be able to support Bali to recover from the pandemic, because Bali is the most hardest hit by the pandemic. So series of the G20 meeting, which is also hosted here in Bali, and the magical environment and ambience of Bali has creating a very, very magical impact on the G20, which is unthinkable before. So thank you, Pak Wagub and all the Balinese community and people for hosting such a very important meeting, which all eyes all over the world are in Bali, and looking how we can actually create this strengthening collaboration and cooperation when the world in the situation is getting more and more tense and divided. So I do hope that the magical of Bali is going to also create a magical impact for this hospital, and especially what is really dear to my heart, looking at the film just before we start, how we are going to be able to help many of the mother as well as children, maternity which is supposed to be healthy, safe, so that they are going to be able to deliver a healthy baby, and all children in Indonesia. You all know that stunting and maternal mortality is the two most important indicator that we still continue need to address. So I do hope that with the support from the Islamic Development Bank, with a strong commitment from the Ministry of Health, with the support of the Ministry of Finance through the financing, as well as the magical power here, a land of God in Bali, you are going to be able to address the issue of helping million and million mothers and children in Indonesia, so they deserve to have a good health care, a better health services, and so they are going to be able to have a healthy life. I wish you all a good luck, and please also execute all this project with a good governance and integrity, so that we are going to be able to build the right facility for many women, mothers and children. Those are the most important for our celebration this morning. Thank you again, President Al-Jasir, Pak Budi, and Pak Wagub, and also for the Board of Director dari Rumah Sakit Sanglah here. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh. Om Santi, Santi, Santi Om. Thank you.
Terima kasih Ibu. Mohon berkenan untuk dapat kembali ke tempat. Hadirin yang kami hormati, selanjutnya marilah kita simak bersama sambutan Minister of Health of the Republic of Indonesia, His Excellency Bapak Budi Gunadi Sadikin.
Mau ke gunung, jangan lupa bawa tali.
Cakep.
Bawa golok untuk memotong semak.
Cakep.
Minggu ini kami ke Bali untuk meresmikan 6 rumah sakit ibu dan anak. Om Swastiastu, Assalamualaikum warahmatullahi wabarakatuh. Your Excellency Dr. Al-Jasir, Ibu Sri Mulyani, dan Mas Tony, Coace, my wife, Ida, ladies and gentlemen. Every woman, gave life every time they gave birth to their children. But every woman also faced a deadly risk every time they gave birth to their children. So mother mortality risk and infant mortality risk are a good proxy of the status of a nation's health, because it reveals the status of the population health, but it also reveals the status of the facility health. So the health of the people and the health of the facilities. And mother mortality rates in Indonesia, as you have seen, is quite high. It's number 2 in ASEAN. I mean number 2 the worst. It's 305, if you remember correctly, for every 100,000 live birth. It is a stark contrast with developed country like Singapore, which is only 8 for every 100,000 live birth. So 305 versus 8. And it is due mostly because of severe bleeding or hypertension or infections. 3 major reasons. And these conditions actually could have been prevented had all of those mothers received a proper medical care. So these conditions could have been prevented had those mothers received proper medical care. Therefore, it is extremely important for the government, for the regional government, to keep investing in mother and child healthcare facilities. So therefore, I'm very grateful for ISDB that have been providing $262 million of loan to expand 6 national hospitals for mother and child facilities. Rumah Sakit Persahabatan, Darmais in Jakarta, Hasan Sadikin in Bandung, Sarjito in Jogja, Ngurah in Bali, and Wahidin in Makassar. I strongly believe in the future, giving birth is not only a matter of life and death for every mother. I believe in the future, giving birth is a matter of joy and happiness for all the parents. And I strongly believe in the future, giving birth is a matter of future greatness and prosperity for every nation. Wassalamualaikum warahmatullahi wabarakatuh. Om Santi, Santi, Santi. Om.
Terima kasih Bapak, mohon berkenan untuk tetap di tempat karena kita akan melanjutkan acara pada kesempatan kali ini. Ladies and gentlemen, we are about to continue for the groundbreaking ceremony. And please allow me to invite to back on stage Her Excellency Ibu Sri Mulyani Indrawati, Minister of Finance of the Republic of Indonesia, His Excellency Dr. Muhammad Sulaiman Al-Jazar, President Islamic Development Bank, Honorable Professor Choka Sukawati, Vice Governor of Bali, to join for the groundbreaking ceremony on this very beautiful day. Mohon izin kita mulai dengan sesi foto bersama terlebih dahulu. We would like to invite Excellencies to take a photo together before we start the groundbreaking ceremony on this very beautiful day. Hadirin sekalian, tibalah saatnya untuk acara groundbreaking ceremony. Excellencies, please to get closer to the LED screen and please to put your hand on it. Kami persilakan dengan hormat untuk dapat mendekat dan menaruh tangan Bapak Ibu pada layar LED. And while we are countdown, dalam hitungan mundur kita bersama-sama akan melakukan peresmian to officiate the groundbreaking, the strengthening of National Referral Hospitals and Vertical Technical Unit, Islamic Development Bank Project IDN 1031. So please be ready on 3, 2, 1. Hadirin sekalian, berikan tepuk tangan yang meriah, round of big applause for the groundbreaking ceremony, the strengthening of National Referral Hospitals and Vertical Technical Unit, Islamic Development Bank Project IDL 1031. Dan telah bergabung bersama kita pada saat ini secara virtual. Join us virtually on the screen, the 6th hospital in this project for DKI Jakarta Province, RS Kanker Darmais dan RSUP Persahabatan Jakarta for West Java Province, RSUP Dr. Hasan Sadikin Bandung for DI Yogyakarta Province, RSUP Dr. Sarjito Yogyakarta For Bali Province, RSUP Profesor IGNG Ngurah Denpasar. For South Sulawesi Province, RSUP Dr. Wahidin Sudirohusodo Makassar. Dan dengan hormat kami mengundang kepada tamu kehormatan untuk dapat mengambil sesi foto bersama dan menuju ke construction site. Mohon berhati-hati dan untuk menjaga jarak. Excellency, we would like to invite you to wear the vest and helmet before the photo session. Izinkan kami untuk mengundang Bapak dan Ibu untuk menggunakan rompi dan juga helm sebelum melakukan sesi foto pada kesempatan kali ini. And now, Excellencies, we would like to invite all of you to take a photo together on the construction site. Ladies and gentlemen, now we would like to invite Excellency to do the press conference to the media room. Hadirin yang berbahagia, untuk selanjutnya kami undang untuk dapat melakukan sesi press conference yang diadakan di ruang media. Our organizing committee will lead the way to the press conference area. Hadirin yang kami hormati, demikianlah rangkaian acara Groundbreaking, the strengthening of national referral hospitals and vertical technical units Islamic Development Bank Project IDN 1031. Sebagai informasi selanjutnya press conference akan berlangsung. Terima kasih atas perhatiannya. Kepada yang tidak berkepentingan kami persilakan untuk dapat memasuki ruangan kembali. Baik, terima kasih kepada seluruh hadirin yang hadir pada kesempatan hari ini. Semoga kita senantiasa diberikan kesehatan. Dan untuk berikutnya kami akan mengundang hadirin untuk dapat menikmati hidangan makan siang. Ladies and gentlemen, distinguished guests, we would like to invite you to enjoy the lunch for today. Thank you for participating on this very beautiful event, ladies and gentlemen. Terima kasih, saya Tismaniar pamit undur diri dan semoga kita senantiasa sehat. Salam sehat, bangkit Indonesiaku, sehat Indonesiaku. Saya tutup dengan Parama Santi, Om Santi, Santi, Santi Om. Wassalamualaikum warahmatullahi wabarakatuh.